let me introduce Dr. Eisenman. He is actually the director of the Public Health Disaster Center, but he is also the co-director of the Healthy Climate Solutions Center. So I hope we can combine these two and find solutions, and we'll hear from him. Thank you for being here.
Well, good afternoon. It's really great to see everybody live and in person. The work I'm going to talk about is work that I've done with Michael Jarrett, who's in the room, Jonathan Fielding, who's in the room, and Diana Gonzalez, who I don't see, Yu, our postdoc. This was funded by both Center for Healthy Climate Solutions as well as the Conrad Hilton Center, and also Sustainable LA Grand Challenge. So we had cobbled together a bunch of work, really actually just to get, this is really a work in progress talk in many ways. So let me set the stage here. The background, of course, is that even under the most optimistic scenarios put together around climate change mitigation, the RCP 2.6, which is an optimistic emissions scenario, even in that case, the bathtub of CO2 in the atmosphere has already filled to the point that by mid-century, and in the definition of the climate change world, mid-century starts in 18 years, in 2041. So, you know, in some of our children's, our young children's early adulthood, by then, as early as 2041, we're going to see 3 to 4 times the number of extreme heat events each year in Los Angeles. So global emissions reduction, even if done, is not going to prevent a significant harm to our population. And of course, the harms disproportionately occur to the at-risk populations that we're often worried about, the health inequities populations, the environmental justice communities. So right now in California, putting together our priorities for spending and action is very much generated by social vulnerability indices. CalEnviro is one that's very well known to many of you in the room. There are several others. And these are usually census level indices of social vulnerability, including demographics, health status, land and building infrastructure variables. And they sum up, or they're done in different ways to look at the social vulnerability in that census index. And while this is very important, it's really not enough. Because I told you, adaptation is required right now. People are dying right now from heat. So if you're a public health agency worker, which I hope some of our students will soon become, or you're an emergency manager, or a land use planner, or you're a mayor's office, you need to know right now, where do I allocate my new batch of cooling centers? Where do I start to prioritize dollars for resilience centers? Where are the communities getting harmed right now? Which is more than just their social vulnerability. Oh, okay. All right, you come to our website. This is now on the Center for Healthy Climate Solutions website. And you'll see a map of California load up. It's kind of slow in normal circumstances, and I guess it's slower up here. And it's going to show us the excess rates of ER visits for heat and the excess numbers of ER visits for heat by county and by zip code. So I'm going to just do the rate for demonstration purposes. And the state loads up. And the first thing we see is actually at a rate level, the highest rates are in the northern counties, which is surprising to me, and I think to many people. And we don't exactly know why, though as we've looked deeper into this, I can give you some ideas. It has much to do probably with acclimatization, lack of air conditioning in homes, as well as the intersection with social vulnerability up there. But let's get down to now the county level, which I think is where the health planner is going to use it. So Los Angeles County's heat officer has done just this, what I'm doing right now. They go down click on Los Angeles. The county comes up. And we see, as it gets increasingly red, that the zip code is a higher rate. These are just qualitative at this point. Qualitative differences in where excess ER visits are occurring. This is using 10 years worth of data from the hospital the HCI data set, formerly OSHPD. And what we can do is zoom in a little bit and compare. This computer is it's got a different kind of pad, right? Than my laptop. So let's compare two zip codes here. I'm going to compare Culver City with its neighbor, West Adams. And pressing the wrong button. Well, I'm having a little trouble with this pad, but what I would try to do is show you that these two zip codes, there we are, we're lighting up now, have very different rates. That the leafier, wealthier community of Culver City has 1.4 excess visits per 10,000 persons on an average extreme heat day, compared to the neighbor right next door getting the exact same heat or getting the exact same weather pattern of West Adams, which has 3.5 excess ER visits per 10,000 on its average heat day. So this is displaying to you just the bald excess rate differences, the disparities between two communities. And what we know then is, and I'm not going to try to do it on this computer because I'm already having fumbling problems with this. You could then take these social vulnerability indices like CalEnviroscreen, which we've put into this website, and overlay them. So you can then see the match and mismatch between social vulnerability and excess ER visits. So you can say to yourself, okay, this district in West Adams, we already identified West Adams zip code as a higher risk right now for extreme hospitalizations for extreme heat. Which census tracts in West Adams should we actually target? Because the zip code is not is too big really for action still. So I'm not going to try that up here, but believe me, you can do that. And we can triangulate the two data pieces here that way. So the audience for this is, as I said, local emergency planners. We have seen already this being used by the chief heat officer in Los Angeles, by the LA mayor's office around planning, and in other counties for similar purposes. For hospitals, they use the number pull-down menu, not the rate, to plan for their hospital surge. They look at their catchment area and which zip codes are sending patients to them the most. In our next step, we are applying for money right now to make a much more polished website, something that's on ArcGIS and much faster on your phone, that will use more sophisticated analysis methods so we can get spatially variant issues here, and to design this with our primary intended users at the table to make sure it's useful for them. Thank you very much.
And now we go and even broader. And if you ever wondered whether we have big data science and environmental health, you probably are now convinced that we do. But Dr. Marlier will actually take us international. She has worked nationally and internationally on wildfires in Indonesia, agricultural waste burning in India, and is also now modeling all of this for us here at UCLA. So welcome, Dr. Marlier.
Okay, great. Well, thank you for inviting me here today to join this panel. I'm excited to share some of the work that I've been doing looking at wildfires. So what I'm going to do in my 7 minutes is start with a little bit of background on the connection between climate change and wildfires, then talk about why this matters from a public health perspective. And then finally, while this is truly a global problem, I want to share some work that we're doing at FSPH that is focused on wildfires here in California. So since this is a panel on climate change, I do want to take a moment and explore that link between climate change and how that is driving changes in wildfire activity. So changes in climate in the Western US are creating warmer and drier conditions. And so this is helping fuel beds to dry out and make wildfires more likely. What you're seeing on this figure on the slide is wildfire burned areas since the mid-1980s in the Western US over time. And this has been split into the contribution that is due to climate change, and that's shown in orange. And there are a couple of key takeaways here. First, without including that contribution of climate change to wildfire activity, models cannot replicate the observed burned area and those increases that we've seen, particularly in the Western US. And also, this has corresponded to a doubling of forest fire area in the Western US. So what are the consequences of this increase in wildfire activity? Well, looking at this series of images that has been collected from a geostationary satellite is probably somewhat familiar to many of us in the room. We've experienced it firsthand in California with several recent severe fire seasons in the past couple of years alone that have broke many records in terms of burned area and lives lost. And what we're seeing here in Washington, Oregon, and California, this was during the 2020 severe fire season. We're seeing actively burning fires in the red and orange shades. But I also want to draw your attention to the large amounts of smoke production that is blowing smoke across the West Coast and also beyond. And my research here at FSPH focuses on this contribution of wildfires to smoke production and what this means for an outdoor air pollution burden. I focus a lot of my work on fine particulate matter, or PM2.5, but wildfires also contribute to other sources of pollution. So recent work has found that in high fire seasons, smoke in the Western US can make up almost half of the outdoor air pollution burden. And this is a growing health threat, and this is suspected to increase with future climate change. So our research here at FSPH is looking at wildfire smoke across a number of different dimensions. First, we look at how can we estimate this exposure? Second, how do we think about who is the most vulnerable? And third, what can we do to reduce the public health burden? So I'm going to share a couple of recent and ongoing projects that are looking at each of these questions in turn. So the first question is, how do we estimate smoke exposure? And my research specifically looks at how can we tease apart that wildfire contribution to air pollution. And to do this, I use a combination of satellite remote sensing data as well as atmospheric modeling approaches in order to estimate the wildfire-specific contribution to outdoor air pollution. And this allows us to do a couple of unique things. First, we can separate out wildfire smoke from other sources of pollution. Second, we can incorporate this information into climate modeling frameworks to try to understand what future scenarios of climate change may bring. And third, we can look at overlapping climate-related exposures. And that's what you're seeing here on this slide. And it follows really nicely from David's talk, but thinking about how populations might be exposed to extreme heat and wildfire smoke at the same time, and what those consequences might be for health. The next question that we're looking at is who might be more vulnerable to wildfire smoke exposure? So this plot is showing results from a study that we recently wrapped up that was looking at the vulnerability of agricultural workers in the state to wildfire smoke pollution. And this is a group who might be more vulnerable due to several factors, including the outdoor and physically demanding nature of their work. So what we did in this study is we ran climate modeling simulations of past and projected future wildfire smoke, and then we analyzed the difference in the context of our primary agricultural producing regions in the state. And what we found, focusing on that first row, is first, the future smoke pollution burden is expected to be the highest in Northern California, as well as parts of Central California. But in terms of vulnerability, agricultural workers who are located in the central part of the state are highly vulnerable to these increases. And the last question that we're looking at addressing is, what can we do to reduce the public health burden? And what we're doing here at FSPH is developing online decision support tools that can quantify the benefits of different land management strategies, such as prescribed burning, that might reduce wildfire severity in the future, and quantify what that would mean from a public health perspective. This is showing a screenshot from an online decision support tool that is currently in progress, where users will be able to evaluate changes in different future policy scenarios and rapidly quantify what the public health benefits would be. So to wrap up, I'd like to talk just a little bit about where we're going from here. So first, as I mentioned, we're interested in exploring the joint health effects of overlapping climate-related hazards. I gave the example of extreme heat and wildfire smoke, and there's potential there, along with other climate-related hazards, to exacerbate certain health conditions. Second, we're building on our vulnerability work to try to understand who across the state is the most vulnerable to wildfire smoke exposure and what people can do in order to protect their health. And finally, we're working to continue evaluating policies to reduce wildfire incidents and smoke exposure. And this ranges from local to regional policies, such as land management, to more global climate mitigation policies. So thank you for inviting me here today, and I look forward to our discussion.
Now I'd like to introduce Dr. Kirsten Schwarz, who is an urban ecologist. And as such, she is engaging with themes such as lead in the soil and the patterning of these events or human patterning probably, and as well as tree canopy and social justice. And she is involved in a lot of community engaged initiatives on green infrastructure, and I'm very much looking forward to hearing from her. Thank you.
Good afternoon. It's really a pleasure to be with all of you today. Thank you for sticking it out for the very last panel of the afternoon. And thanks to the organizers. It's really been a pleasure to hear about all of the really exciting work being done at Fielding, and really inspiring to continue on the theme of building a healthier future together. So I am an urban ecologist. I have a joint appointment in the Fielding School, Environmental Health Sciences, and also in urban planning. And as an urban ecologist, my research interests are really at the intersection of environment, health, and equity. really recognizing that in many ways, our health depends on the health of our ecosystems, right? And these environmental systems hold tremendous capacity to build climate resilience. But as we heard earlier in the health equity panel, the benefits that we receive from environmental systems, we often refer to these as ecosystem services, are not equally distributed. And neither are the burdens. So my earlier research really focused on documenting these inequities. We've documented the incredible disparities in tree canopy cover across United States cities, showing that higher incomes are often associated with greater canopy. That is canopy that helps us mitigate extreme heat and intercept particulates. We've also documented patterns of soil contamination in cities. You can see on the right panel of this slide. It's a known environmental justice concern and one that really compromises our soil systems that again hold the capacity to sequester carbon, to intercept stormwater runoff, and form the foundation of our food systems. So in more recent work, I've been interested in what are the ways we can address those inequities? What are effective strategies towards sustainable solutions? This is work from Newport, Kentucky. It's a small river city. And like many in the region, it struggles with combined sewer overflows. So stormwater and sewage are carried in the same pipe systems. And during really large storms, we often see that those systems are overwhelmed. And that means that we have untreated sewage that's being discharged into the Ohio River, which is a drinking water source for the area. So unsurprisingly, water quality is a concern of the community, and so is access to green space. So in this project, which was called Strategic Depaving, we proposed to address those community identified needs of water quality and access to green space through identifying impervious areas in the neighborhood, removing them, and replacing them with community designed green infrastructure. So the outcome of this project was a community designed green infrastructure project, one that we hope addresses those community identified concerns, again, of water quality and access to green space. But what I really wanted to highlight here, what I think is really critically important, is the process of doing that work. So the process, I think, is what really mattered, the process of engaging communities in the scoping and development of this work, in the implementation and the evaluation of this project. And I think it's the process that has really enabled the work to continue. So there's a Strategic Depaving 2.0, where our community partners continue to work with the City of Newport to remove impervious surfaces and replace it with green infrastructure. So I've aspired to apply that community-centered approach with my work in LA as well. This is the Healthy Soils for Healthy Communities project. It's a collaborative project with a local nonprofit called Tree People. And as part of that project, we've worked to understand what communities in LA that are active in urban soil work value and prioritize in terms of research and action. And this really lays the foundation for future soil work in the region. And so you can see here what was identified through community focus groups. These are the priorities. Folks would like to see accessible and transparent soil data and testing, effective community engagement and streamlined communication, work that centers underserved communities, and building those alliances among different communities, including policy folks, businesses, and science professionals. Fielding students have been a critical component of this work. This is research completed by Nicole Fernandez-Vina. She is a recent graduate of our MPH program. And during her time here at UCLA, she worked on the Healthy Soils for Healthy Communities project. She was really interested in how have communities been engaged in urban soil pollution research and what processes have resulted in change. So she completed a literature search. She identified relevant studies And then she assessed their community engagement methods through an existing tool. So that's what you're seeing up here on the slide. This is the spectrum of community engagement to ownership. It allowed her to look at the research studies, look at the methods that they were using, and see how it aligned with their community engagement goals. And what she found is studies that tended to engage communities on the right side of the spectrum were more effective in terms of community change. So studies that engaged communities through things like involvement, delegating power, deferring to communities, they more often mention structural change as part of their work, including things like securing funding for remediation, creating plans to improve environmental conditions, and greater community agency. So one final project that I'd like to share is Heat Resilient LA. David laid the foundation here that heat is a major equity issue in LA. The number of extreme heat days is expected to increase. Heat can be deadly. Shade is not evenly distributed. A recent urban forest equity report found that nearly 20% of the tree canopy in LA is concentrated in just 4 neighborhoods where less than 1% of the city's population resides. And in a changing world, I would argue that shade goes far beyond an amenity or something that's nice to have, and instead represents critical infrastructure, something we all need access to. So the goal of Heat Resilient LA is to co-design cooling solutions in the places that need it most. It's a large interdisciplinary team. We bring together folks from across campus in material science, public health, urban planning, law, and policy. The idea is to collectively harness the knowledge within the academy, knowledge within communities across LA to co-design passive cooling structures. So to do that, we have 2 immediate questions to answer: where the structures will go and what they will look like. So where the structures will go is informed by our conversation with folks in neighborhoods on their experience of extreme heat, as well as our analysis of cell phone mobility data that tells us where and when people move around the neighborhood on high heat days. And the design of the interventions incorporates radiative cooling technology with, again, community feedback on design preferences and the experiences of the prototypes that have been developed. So my take-home message that I wanted to share with all of you today is that the process of how we do our science matters. And I think that that process is changing to address environmental grand challenges. So this is from a recent NSF report on the potential of engaged research to address environmental grand challenges. And processes like engaged research value meaningful collaboration among scientists and non-scientists. They explicitly recognize that science alone is not sufficient to ask the right questions or enable new discoveries or translate those discoveries to meaningful solutions. And I think that we've heard today throughout these talks, often people that are most impacted by environmental change are excluded from decision-making processes and from designing solutions. And through some of the work that I've shared here today, we're hoping to change some of that, recognizing that if our solutions are not aligned with community need, we really miss an opportunity to build just and sustainable climate-resilient futures. I just wanted to say thank you for celebrating with us today. I look forward to the conversations and working with all of you to build a healthier future together. And I shared one of my favorite quotes from Jane Jacobs, that cities have the capacity of providing something for everybody only because and only when they are created by everybody.
We have our panel, and I'm glad to be the moderator. Please ask your questions. Too tired. All right.
Sorry for that, but have you considered doing any work on the soil microbiomes in consideration for high heat and smoke exposure?
That's a great question. So, no, I have not. So my work is, I've traditionally focused on air pollution. It seems like a collaboration that perhaps Kirsten and I could have, looking at climate change and the soil microbiome, but that isn't something that we have looked at yet, but I think it's great when you're thinking in the context of the multiple different pathways for exposure and how those can all nest together, and that in itself is something that I'm really interested in.
That's actually a really interesting question, because there was this issue raised 2 years ago when we had one of our big wildfires in California. What soil is being scooped up by the heat, the rising heat? And you all know we have something called valley fever in the Central Valley. And you know, how are we actually transporting these spores over large areas and possibly infecting large urban populations with these soil fungus spores as well? And there's certainly a potential for that as well. Yeah.
Question for David. It's a very interesting app that you showed, and you were looking at basically neighborhood effects. I was wondering, have you actually looked at this from a health disparities perspective and trying to see what is causing, and I don't mean to use cause as a causal effect, but what could be some of the underlying factors generating those discrepancies in neighbors and in neighborhoods?
Yeah, so we have a postdoc who's doing that analysis, actually as part of the project that Kirsten talked about, the Heat Resilient LA. And we looked at the correlations between the measures that are available in all the social vulnerability indices I mentioned. And there's 5 or 6 of them that are available in California. And what's very interesting on our analysis is one that very few things really correlate consistently. What is correlated in Northern California is different than in Southern California. The one thing that's correlated across all, generally across all counties and zip codes is, not surprisingly, access to home air conditioning, Latino ethnicity, and some transportation, access to transportation variable, I can't recall which. But age, which we would have thought of, is not. Income is not. African American, other groups not. Though they are in certain regions. So this actually goes back to the issue of social vulnerability as a useful but somewhat incomplete way of thinking, because what will be your at-risk population or your socially vulnerable population to, for instance, heat, will differ, we think, in different parts of any geography. So not surprising. So this is sort of an important conclusion.
Eva.
I'll take 2 quick stabs at that and then pass the mic. One was, I would say that actually the data shows that population opinion on climate change has rapidly changed, and that somewhere over 75% of Americans across political parties now believe it's occurring, that it's human-induced. Now, and that's across political parties. So I think there's a very palpable and documented now change in public opinion. We no longer are fighting the idea that this is just polar bears, because people are experiencing it themselves. I will say that one thing I recommend is to actually learn about the climate change experiences that we're having right now and tell that to your friends and neighbors. I do that with patients. So I really enjoy doing this when I put on my stethoscope and a patient comes to me with worsening seasonal allergies. And I describe how seasonal allergies are starting earlier, ending later, and worse and harder to control, all because of the effect of climate change on pollen. And I bring home its current effect on you, even though you might be coming from Bel Air, and so it's not really something you're too worried about. Now you're seeing how climate change is affecting your health. So I try to make it very personal there.
I think you probably won't be surprised by my answer in terms of connecting it with communities, but I really do think that the entry point is listening to communities about their concerns about the environment as a starting point. I think often those concerns that are identified by the community are related to climate change, and I think there's opportunities throughout that dialogue along the way to make those connections between what are you concerned about and how does it connect to this wicked problem of climate change. I'm really glad that someone introduced wicked problems because it's very relevant to this panel.
Yeah, I agree with both what David and Kirsten have said. And I think really to emphasize, it's a unique perspective that we can bring from public health, because climate change can be somewhat abstract to many members of our community. We talk about mid-century or end of century and an increase in greenhouse gas concentrations. What does that mean for you or your family today? And that's part of why I got into this work, was we were looking at public health impacts, because that's what people are worried about, and that's what they're concerned about for themselves and for their families. And the other thing that I would say what we've started to look into is looking at how past variability can inform how we think about potential future changes as well. So past variability in climate that we can already see on the ground what is happening for various public health outcomes, and how we can use that to further our understanding and support some of the future climate scenario modeling that we're doing as well.
Thank you. Mike.
I have a question for Kirsten in particular about the whole panel. Climate change challenges so many of our institutions, and when we look at the reduction of science that gets funded at the federal government level, how do we change that model so that we can start to address climate change? Because I think there's been money that's come from the Biden administration, but the institutions that are giving it out are still very much structured on the biomedical model or natural science reductionist model. So I know you've been working at NSF, but
Well, I'm not joining you today in my capacity at NSF, but in my capacity at UCLA. But I do think that part of that work is on us. Part of that is in our proposal preparation, making those connections between the basic science that is funded at agencies and how it's relevant to the work that we're doing. One of the things that I'm really interested in, I know this is not directly your question, is if part of addressing this wicked problem of climate change is community engaged work, we definitely don't have funding models that really align with co-production models, co-production of science models. So that's something that I've been really interested in terms of changing our funding models, is how can they be changed so that they align with models of co-production, right? A big emphasis of co-production is that you're working with communities early on in developing research questions, and that's not how the majority of our funding is structured. The majority of our funding is structured around coming in with identified research questions, a methodology, and in practice, usually reaching out to community partners at the last minute when you're putting something together and asking for partnership. So for me and my work, I would really love to see us funding more of the relationship building that is so critical. Dean Dorian said it earlier that the relationship building is so critical to this work. That's part of the process that we don't typically fund, right? I don't know that I answered your question about how to convince the funding agencies to give us more money, but I think we're also challenged with how we do our science in terms of bigger team science and interdisciplinary work, which I think is where the really exciting work is happening, and that means asking for larger amounts of money for a pool that is not growing in proportion.
Well, I spent a few days last week on a strategic planning meeting with the NIEHS, the National Institute of Environmental Health Science, and of all of the discussions, climate change was the #1 issue for the next 5 years that came out on top that we need to tackle or do more research in and develop. However, we all know the NIEHS is so terribly underfunded compared to all of the NIH institutes that no solutions will just come from that institute. And we all probably have to lobby other institutes to spend some of those funds as well in this area.
Yeah, I mean, that's been my tactic all along, which is that, we do a lot of collaborations with other partners in other sectors who get funding from other agencies. And being the health person on the team has been really valuable to them. They don't really know how to quantify or how to measure, how to think about health outcomes. So that's been my way of slyly getting more funding, and then, of course, putting health onto the agenda. And I would also add that it's the #1 issue for voting now. I mean, let's just be simple about this. It should be the deciding way you vote for candidates is on their climate change policy. And that's not research alone, that's other things. But it's the existential threat to the globe. And if you're not voting based on the candidate's climate change policies, then you're not doing the simplest thing that you can do.
Thank you. That almost sounds like a final word. We are at 3 o'clock. Is there any last pressing question? Shane.
Yes, just to continue that conversation, trying to do political action is really the most important kind of practical things that might occur from all of your results. In addition, of course, to getting more funding, if less academics want at any rate. So how do you think your results can help that, to do that in your research?
I'm at a different stage than the assistant professors on the panel. And I also have been through 20 years of disaster research where I realized that all the research makes very little difference in some ways, having gone through the pandemic now, and have decided that I'm going to do much more advocacy. So I'm joining advocacy boards, advisory boards, I'm getting active. I think there are stages in your life where you just decide that research is not enough and you have to be active. That's a very personal decision, but I would recommend we model that for our students, that we make it okay in the academy to be activist, and that we trumpet at these kinds of events beyond our research, our activism.
Thank you, David, for saying that. I've been an activist when I was a student. I've been an activist probably my whole life. Actually, I have come to a point where, close to retirement that I am, I'm thinking the courts can help as well. So, testifying and going out there and joining big lawsuits against those who pollute and those who contribute to climate change is probably another way that we can help make change happen a little faster. And I don't think we have another 30 years to wait for some of the results. So be brave and make known what you know. And with that, thank you very much for this engaging afternoon, everybody on the panel.